activity. The World Health Organization, the American College of Gynecologists and Obstetricians, the Department of Health in Australia all agree that 150 minutes of moderate intensity exercise or 75 minutes of intense exercise is what the general population needs. Moderate intensity exercise for a pregnant woman is going to be less than what they can do before because they got increased blood volume. There's a whole bunch of things that go on, changing their weight, but it's still good for them. And people don't remember this, 2 sessions at least of whole body strengthening. Now, from what I've read, Pilates and yoga do not count as moderate intensity exercise, but do count for whole body strengthening. Moderate intensity exercise is not long walks on the beach at sunset, right? Like it's going so that you can say a few words, but not have a long bitch session where you're walking at this pace or, you know, talking about the footy or whatever. Like moderate intensity exercise, I say is like a 6, 7 out of 10 type intensity. And it's good for you. There's so many benefits for it. I love this infographic. This is done by the by medical officers in UK. The reference is down there. All right, so there are contraindications for exercise, and there are relative contraindications as well. These are all there. I'm just going to move through it relatively quickly because it's easy to read and understand. There are samples of safe and unsafe activities, and I was surprised, but they've got racket sports and strength training and running in there, which is fantastic. I think contact sports, they're recommended not to be played, which I think makes sense. The last thing you want is somebody to elbow you in the guts and you have some sort of accident or your baby comes out with prematurely or even worse. Scuba diving because of the pressures, high risk of falling because of the accidents, skydiving because of the jerking, and the hot yoga, hot Pilates because of the inability to regulate the temperature. I think it's all pretty sensible there. Warning signs to discontinue: vaginal bleeding, regular painful contractions, amniotic fluid leakage, breathlessness before you start exercising. I think that just goes for everybody. If you're going, yeah, I gotta start up my warm up now. It's like, dude, maybe you shouldn't be here, right? Dizziness, headache, chest pains, muscle weakness affecting your balance, and calf pain or swelling because of the risk of clots. You just want to make sure that that's not a thing. All right, some of the postnatal considerations. So for the antenatal exercise, in general, I'm happy for most things to occur. I've got a video on my Facebook somewhere and she's given me permission to say her name. Her name's Talia, and you know she competes in aerobics. And I asked her to give me 5 burpees when she was 37 weeks pregnant because she was doing burpees. I said, I've got to film this because people need to know that your life doesn't end when you're pregnant. And she goes, okay. And she knocks out 5 burpees and it was great. And then she goes, oh, show me, you know, because she wants to see. And she goes, oh, I can do them better than that. Do you want me to do them again? It's like, no, they were great. Like they were really good. 37 weeks pregnant. Like she couldn't get her chest to the ground because her belly was that far in front of her. She was fine. She's still fine. She's got 3 kids, still competes in aerobics. And, you know, it's a good thing to do. Exercise is a great thing to do antenatally. I restrict them based on their symptoms. I restrict them based on what they're coming to talk to me about. Back pain, hip pain, knee pain, shoulder pain, neck pain, lack of sleep. So if people have a lack of sleep because of whatever reason, I don't get them doing complicated movements because there's just, we know that sleep deprivation is like being 0.05 drunk, right, or worse. So you're going to...
with kids under 5.
Yeah.
No, we should be doing just very simple things.
Not simple, just considering the lack of sleep.
Yeah.
Yeah. 100%. Not everybody. I manage to sleep. I can sleep through the second coming of Christ, I reckon. I'd have to put a note on my forehead going, don't forget to pick me up on the way through. All right. So antenatal, I think, is easier. I think it's easy to develop an antenatal exercise program because all things being equal, not too much to worry about. Yeah, there's placenta position. Yeah, there's gestational diabetes. Yeah, there's, preeclampsia, so high blood pressure. There's things to worry about, for sure, 100%. But the list is smaller. Postnatal, I would not feel confident and still do not feel confident about producing an online postnatal program, right? Because there's so many variables. And I think it can be done. I think you can educate people. People are doing it. I think it can be done. But if it is being done, you'll find that it's super conservative. Because it by nature has to be. Right? And then you end up with a whole bunch of people having done a whole bunch of online programs that are all conservative, and now they're scared. Okay, so I remember I was teaching in America. It was, this time last year. And I had people who'd been 3 years postnatal, had done this program, and they were very, very, very good at it, but they didn't realize that there's more to do. Right? So I'm not knocking the program. I'm just saying there's more to do. There's more to do. And so, it was fun taking them through that. They took 2 hours on that diastasis one. That was the one that really made me change the program because they just wanted it. And then I went to the next group and I gave them the option. They go, no, we want to do this. I was like, all right. All right, so postnatal considerations, when do they go back? All right, they can go back almost straight away for certain things, depends. I'm not going to ask them to do a 1RM back squat or their old 1RM 3 weeks after giving birth. That would be kind of irresponsible. There may be 1 in a million that could do it though, but it would be very small. How quickly do they progress? They progress as quickly as they feel able to without feeling pressured to have to do something. There's so many variables, right? So many variables. Do they do abs or not? Yes, I like it. Do abs. How you do your abs is more important than doing abs. We'll talk about all that stuff in the next section. Pre-pregnancy and antenatal exercise considerations. Basically what you did before you had a baby is a good indication of what you might be able to do. Lisa Ondieki ran every day of her pregnancy. She gave birth. She probably took up running soon afterwards because she was trained and conditioned. Somebody who lay in bed because they had a cervix that was, I don't even like the word incompetent, but it's an incompetent cervix. And so they're in bed and they're lying in bed because if they came up, it's going to spread open even more. Not a good idea to just start training for a marathon 3 weeks afterwards, right? It's pretty simple stuff there.